Decreased fetal movement gets top billing. It's like it is the most important thing out there, but we don't talk a lot about increased fetal movement. And I want to talk more about that today because fetal movement is your best indicator of fetal well-being. And I'm so glad that you're here because this is an important conversation to have. Honestly, I think the reason why it isn't talked about a lot is because you really need to have an expert who's seen lots of different people with lots of different kinds of fetal movement, as well as increased fetal movement and decreased fetal movement, and is willing to pore over the studies. In case we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm so glad you're here to get prepared, not scared, for your upcoming hospital birth. Now, before we get started, your provider might be doing kick counts wrong or telling you how to do kick counts wrong. So grab my kick counts cheat sheet. They're really trying to adjust how everyone, especially in the United States, talks about fetal movement. And I have what we're aiming for down there. So grab it at the link below. Okay, fetal movement is your best indicator of fetal well-being. Always remind yourself of that because I think a lot of people are like, oh, it's an ultrasound or oh, it's the NST that they do in the hospital. But in reality, you have inside of you the best alarm system possible for your baby. Now, a lot of times that's decreased fetal movement. Usually with kick counts, it's a lot of baby is moving less. It takes longer to get those 10 movements than it used to. However, studies have shown that increased fetal movement can also be a problem. Now, this is a trigger warning. If you have a lot of anxiety about stillbirth, this may not be a conversation that assists you, but I want to talk about what the studies show, especially in stillbirth moms. They showed that moms whose babies ended up being stillborn, a lot of them felt a big, huge amount of movement before they found out that baby was stillborn. And they just said like a lot of movement, like baby is thrashing in the womb. And I want to give you some things to think about before you get super anxious about this, because your baby is going to have periods where you think it is the freaking war of the worlds in there, especially mid-pregnancy. Baby has a lot of room and it does seem like they are going to town in there. Now, there is no real pattern of fetal movement until you get into your third trimester. So that's 27 to 28 weeks. Some people who are considered high risk, they recommend that you start kick counts at 25 weeks. Any questions, talk with your provider. But if you're before 27 weeks and you get that war of the worlds thrashing around feeling, you have to remember that you're starting to just learn your baby's pattern. And a lot of that is based on where the placenta is, how the baby is facing in the womb, and all of these different things, which is why we really don't recommend kick counts until 27 weeks of pregnancy. Once you've established your baby's regular pattern, and it is likely that your baby has a regular pattern of war of the worlds in there, where they are just moving a lot, they're feeling really good, just like how you or I dance when we feel really good. But if you're noticing something outside of that norm, it might be a reason to go get help. Feel free to call your provider or head into labor and delivery. The new recommendations are any changes in fetal movement, that means increase or decrease, you should be going to get help. Most people, by the time you call your office and they return the phone call, it's going to be too late. So for most people, I recommend going into labor and delivery if you really feel like something is wrong. Okay, so it is sort of an old wives' tale that there is increased fetal movement before somebody goes into labor. And today I want to give you some of the reasons why that might be. There are a few studies that sort of corroborate this, that people tend to feel more movement, and I want to tell you a little bit why. First off, you're really paying attention. The majority of people, the closer you get to your due date, you are probably not working, you're probably spending more time on the couch, you're a little less busy, and you just have a lot of time to sort of just watch that uterus, which can lead to you feeling like baby is moving more because you're just concentrating on it more. Again, if you're doing kick counts, those should remain pretty stable, even if you're off work or just watching your uterus more. So that's why I always recommend doing kick counts from about 27 weeks on. Now, some of this may be to fetal positioning. As baby moves into your birth canal, they just start to wedge in there and there's nowhere for them to go. And so they sort of just kick around more, and you might feel it more in specific spots because they just aren't able to move around as much as they used to. So as baby heads into there, you'll feel a lot more kicks maybe in a specific spot, and you might feel more in an area that you don't enjoy feeling it in, and you notice every little movement that happens in there. I swear my kids would sort of claw at the lower edge of the uterus, and it felt so weird. So I think that's something that a lot of people notice as they head towards their due date as well. Now, a lot of people will say you'll feel less movement as baby gets closer to the due date. It is true that the characteristics of your fetal movements are going to change as you head towards your due date because the baby is just more cramped. They can't pull back to really kick you, but they're more moving and squirming. And that is going to happen over time. Again, why we do kick counts, because you're going to notice that, yes, our movements 2 weeks later are a little bit different than they were 2 weeks ago. But from yesterday to today, they seem very similar. And that's why you want to do kick counts, because you're noticing day to day how things are different. Once again, the number of movements would be very similar. It's more the characteristic, more squirmy, less full-on kicks than you got before. And this can be really tricky. So if you have any questions, always ask your provider. I'm 100% on board. And if your provider is saying kick counts don't really matter, feel free to take them the studies that I have. I have a whole article on this that I'll link down below, but there are studies that show how important fetal well-being is. In fact, there's an app called Count the Kicks, and they've studied that kick counts decrease stillbirths by 33% when done correctly. Now, let me give you a few caveats. It is not getting 10 movements in 2 hours, which I hear a lot. It is not just monitoring fetal well-being, because that is difficult to really know. And it's definitely not just 10 movements in the day. I hear all sorts of different things coming from providers. So definitely ask your provider what they think about fetal movement at your next checkup. Like I said before, this is something that we're trying to shift in the United States, but as you can imagine, it's a big country and it's difficult trying to get everyone to shift at the same time. Now, I think it would be really interesting. Tell us in the comments what your provider has told you about kick counts. I think that would be really interesting to hear. And especially for people outside the United States, I'm always interested to hear what they do in other countries as well. One other time that you tend to feel, again, a difference in the characteristics of the movement is if your water breaks. Now, obviously, you're pretty close to delivery at that point, but then baby is really wedged in, doesn't have this extra fluid around them. And so movements can change. Once again, the number of movements should be similar, but the characteristics can change once your water is broken. And a lot of people hear this. They're like, oh, increased fetal movement means I'm going into labor. And they'll think, I think that's increased fetal movement. I must be going into labor because you are tired of being pregnant. I have been there. I totally understand it if you have been there, but I think that's something that may fuel the fire on this one. Something a lot of people wonder is if baby will continue to move while you're in labor. And they 100% do. In fact, that's one of the questions we continue to ask you while you're in the hospital as a labor and delivery nurse. A lot of people are caught off guard by the fact that they can still tell, even with an epidural, that baby is moving in there. And so we want to see that. It's so important. And still take note of it because your nurse is going to ask you, I hope. And if you want to know more about how the hospital works and really getting prepared for your upcoming hospital birth, come join me in the online prenatal class for couples. Now, kick counts can be confusing, and I actually have the Count the Kicks people on my podcast. I'm going to put the video link right above me so that you guys can listen to that, because it can be hard. Am I doing it right? What if I miss a day? Things like that. We go over all of that in that podcast. Okay, just a few things I want to remind you. Number 1, fetal movement is your best indicator of fetal well-being. Number 2, do your kick count starting in your 3rd trimester. And number 3, talk with your provider if you have any other questions. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.